Hi everybody, my name is Dr. Kimberly Sanders, and I'm going to be talking to you today about autoimmune disease and oral health and what the connection is. So I am a specialist in autoimmune disease and the naturopathic management of autoimmune conditions, and today we'll be covering rheumatoid arthritis, lupus, scleroderma, and Sjogren's, and the connection between these autoimmune diseases and oral health. So the first thing that we'll just talk about are the well-known established conditions that are related to oral health and gum disease. So for example, over the past 10 years, the associations are pretty well documented between oral health and heart disease especially, but also lung disease, kidney disease, and even cancer risk. So at this point, those conditions are pretty well established to have some kind of connection to oral health. And what is the connection? So really, what it comes down to is inflammation. So inflammation in the gums can be one of the first manifestations of how inflammation is potentially running rampant in the rest of the body. Secondly, bacteria. So not only is the inflammation connection super important, but more and more research is looking at the bacteria in the mouth and how that correlates to disease. So a good example is those who have mitral valve disease might be familiar with the process of having to go on antibiotics when they go for any kind of dental work. So it's very clear that bacteria in the mouth can translocate and move to different parts of the body. So this is an important factor when it comes to the autoimmune diseases that we'll talk about. So autoimmune diseases, as most of you know if you're watching this video, you probably have a pretty good idea of what they are, but they are largely characterized by the immune system attacking the own body tissues and a lack of tolerance to self. So in the normal development of the immune system, the body does a pretty good job of removing any immune cells that will become intolerant to its own tissues, and normally those things are destroyed. But in autoimmune diseases, this tolerance to self is lost. So because of that, there is a lot of inward attack where the immune system is attacking the own tissues, and that really does lead to massive amounts of inflammation. And this is usually done through autoantibody attack. Autoantibodies being antibodies that are formed against the body's own tissues. Normally, when there's an infection or a sickness, the antibodies are generated against foreign invaders, but in the case of autoimmune disease, the own body's tissues are essentially considered the foreign invaders. And a lot of different autoimmune diseases have really varied symptoms. So it's not just joint disease, it's not just fatigue. It really can affect the GI system, the neurological system, many other systems. We do know that females are more affected than males, and it's important to remember that autoimmune diseases affect a varied range of age. We often think of rheumatoid arthritis as a disease of the elderly, but it's actually more common in women 20 to 40 years old. But also understand that autoimmune diseases can range from babies, even 2 years old, to the elderly. So rheumatoid arthritis is an autoimmune disease where autoantibodies are depositing into the joints and causing inflammation in the joints. That's really the hallmark of the disease, causing pain and restricted use of the hands and other joints, the cervical vertebrae, shoulders, really any joint. And the most common and significant antibody found in rheumatoid arthritis is something called anti-CCP. And anti-CCP is induced when alien proteins are formed in the body. So these alien proteins are foreign, and so the body recognizes them as foreign, and anti-CCP is the antibody that kills them, or not kills them, but attacks these proteins, these foreign proteins. So how does periodontal disease have anything to do with this? Well, these alien proteins that rheumatoid arthritis patients are making antibodies to are caused by an enzyme called PAD. So basically, PAD induces CCP antibodies, and that essentially causes RA. Well, what causes PAD to make these proteins? Periodontal bacteria really are becoming a major culprit for inducing PAD. A bacteria called P. gingivalis actually increases PAD activity, which increases the alien production of these proteins. and thus increasing autoantibody production. We know that P. gingivalis worsens RA, and it's possible that P. gingivalis actually triggers RA. Some research, there was a study in 2013 that associated P. gingivalis with higher CCP levels and worsened disease severity in early RA patients. A 2014 study associated P. gingivalis as the only bacteria known to produce PAD, and the authors claim that this bacteria likely plays a significant role in the pathogenesis of RA. In addition, cardiovascular disease is one of the major causes of death in patients with RA. And we already talked about how dental health is so strongly correlated with cardiovascular disease, so another reason to address dental health in these patients. So clearly, P. gingivalis is gaining a lot of notoriety for its role in RA, but it also has roles in some other autoimmune diseases. For example, Scleroderma. It's an autoimmune disease that causes excess scar tissue deposition in the body. So an October 2014 study correlated that diminished interincisal distance between the teeth is related to overall disease severity, and also tooth loss is associated with poor upper extremity function, GERD, and decreased saliva production. So we don't know if these are just correlations or causations. We don't know. There are no studies about treating these kinds of diseases in scleroderma and whether or not the scleroderma gets better. Sjogren's disease. Sjogren's disease is a disease of an autoimmune disease that leads to inflammation in the salivary glands and also the lacrimal glands of the eyes, leading to dry mouth and dry eye. So if you have dry mouth, you're not getting all of the antimicrobial action from the saliva, which can increase the risk of periodontal disease, which will worsen the inflammation. So for Sjogren's disease, we're not really saying, there's no research that periodontal disease triggers the disease, but it's very, very likely that it could be making the inflammation worse, since the low saliva production can actually exacerbate, or should I say the low saliva production can enhance the growth of bacteria, and that gingivitis that would result could cause more inflammation. Multiple sclerosis. So MS is considered an autoimmune disease against the cells of the central nervous system, leading to demyelination, which means that the neuron connections are disintegrating essentially. This causes numbness and tingling, weakness, loss of balance, double vision, debilitation, and many patients do end up restricted to a wheelchair. So how does this have anything to do with periodontal disease? Well, a 2002 study explains that there is evidence that infection with periodontal pathogens, especially P. gingivalis, may play a role in the pathogenesis of MS. So it seems that there's a similar mechanism to what we saw with RA, where this P. gingivalis infection in the mouth is causing autoantibody attack, and in this case on the brain. Lupus. So we don't see any studies yet that P. gingivalis is a trigger for lupus at all, but there was an April 2014 study that said periodontal disease treatment does have a beneficial effect on controlling the disease activity in lupus patients, even when they're under immunosuppressive therapy. So it's interesting that even though there's no connection about the cause of lupus having anything to do with periodontal disease, this study shows when you treat the periodontal disease, lupus actually gets better. Is it the inflammation? Maybe. And we also know that heart attack can happen in lupus patients, so this is another great way to maybe address that risk factor. So what are some of the natural things you can do for P. gingivalis? Well, there are some studies from April 2014 about xylitol. So xylitol is a natural sweetener, and this April 2014 study says that xylitol actually does kill off P. gingivalis, so that's great. And these authors say they support the use of xylitol in periodontitis, which is a good thing. It tastes delicious, and it's found in a lot of gums and toothpaste. But you can also just make a rinse with just xylitol and water. A November 2005 study showed that xylitol also inhibits the growth of P. gingivalis. So again, saying that xylitol would be a good treatment. Other things you can do, probiotic toothpastes and mouthwashes. So even though that might not sound so enticing, a November 2013 study said that the administration of lactobacillus lozenges could be a useful adjunct for chronic periodontitis. You can also always use Golden Seal mouthwash, Thyme mouthwash, Tea Tree mouthwash. So all of those things are going to be antimicrobial and help. So ultimately the question is, that's great, periodontal disease is associated with these diseases, but so what? If you get rid of the periodontal disease, does it make a difference? So there is a study answering that exact question. So in April 2014, there was a review that asked, does periodontal treatment influence clinical and biochemical measures for RA? And what they found is that periodontal treatment did reduce sed rate and reduce some inflammatory cytokines and also disease activity scores, but there was no change in rheumatoid factor, CRP, or anti-CCP levels. So how do we interpret this? What this means to me is that periodontal treatment is extremely important, but it can't work alone. So what else needs to be done? Well, as naturopathic physicians and as myself being a naturopath that specializes in this area, really getting to the underlying cause is important. So identifying other infections, so the biggest being gut bacteria, but also lung pathogens, any mucosal sites, so mucous membranes, are really important. So in January 2014, there was a study in the Current Opinion of Rheumatology, and the author said, mucosal sites exposed to a high load of bacterial antigens, such as the periodontum, the lung, and the gut, may represent the initial site of autoimmune generation. And this is something that as naturopaths we've known for years, that dysbiosis and gut bacteria overgrowth can definitely be a trigger. So we need to look at that. We need to reduce inflammation naturally. We need to find other triggers. Are there food intolerances? Are there viral infections? Then we need to also deal with stress and nutritional counseling. So that's what I have to talk to you about today. So hopefully you found that interesting, and let me know if you have any questions. Take care.